So I think it's very important that we start the dialogue as soon as possible. The earlier the better in terms of the patient journey. And it's not just, of course, the onus on the patient to raise these issues. It's important for the healthcare professionals to also raise the topic and ask people what they're planning. But I think if that isn't brought up in a consultation, if patients feel comfortable, I believe it's very important that we do that as early as possible so that we can plan for the patient in terms of lifestyle, treatments, what their goals are, what their needs are. And I think that is critically important to give an individual the best possible experience. Absolutely. So it isn't just, of course, just women who have to face these issues. It's our male patients as well. And we would normally encourage individuals to bring their partner with them when we want to talk about these types of conversations. And so if a patient flags this up and they happen to be on their own, we'd often ask them if next time if they're able to bring their partner with them so we can have a really good discussion about what the options are. And I think the first important issue to address is the issue of lifestyle. For any person, whether they have psoriasis or not, it's important to think about being as healthy as possible, thinking of lifestyle factors that might have an impact on the pregnancy, such as smoking, alcohol, for example, exercise, weight management. So those are very important factors which do require earlier planning, if possible. And then the other issue to talk about is what the therapeutic options are. And we have, as you know, topical treatments that can be used. There are systemic oral drugs, there's light therapy, and then we have these other class of drugs called the biologics, which are injectable treatments, which are slightly different in terms of how they work as compared to the systemics. So I would say absolutely speak to a healthcare professional. Sometimes patients say to me they were reluctant to raise the issue because they were afraid that we would stop their medication because we knew that they were planning to become pregnant. And I think patients should be very reassured to know that that would be extremely unlikely that that would be the case, because we have so many good treatment options available to us that we could offer and discuss as alternatives if they were planning to conceive. So I would encourage patients to speak with their medical team, and the earlier that they can do that, the better, because then we are able to plan and support them during this journey, as it has its ups and downs and twists and turns. So I think ideally, if someone finds that they are pregnant, they should contact their healthcare professional and arrange to see them as soon as possible, because I think these conversations are terribly important. I think if a person's unable to do that, it's important that they perhaps then go to their GP to help them to get access if they need that more specialist help. And what's also very important, depending on what treatments the person's taking, is that their antenatal team, their obstetrician, are also made aware of the other treatments, because that may influence how they follow them up and how they manage their antenatal care. Of course, so when we think about the management of psoriasis in a person planning to conceive, we first of all must go to the general measures, so the lifestyle issues in terms of perhaps some of the lifestyle factors that we need to consider: alcohol, smoking, for example. And then if we look to the treatments, there are four main categories we'll consider. We have the topical treatments, so the creams and the ointments, and we need to choose which ones we use at which stage of the pregnancy. If a person needs more treatment because the extent of the disease and its impact is greater, then we could consider offering a patient light therapy or oral medication. And the one that we would use for someone who's planning to conceive or someone who's pregnant would be cyclosporin. But that would need to be done with appropriate monitoring and, of course, a lot of discussion with the person in terms of the potential side effects and the benefits of taking that drug. And then we also have another category of drugs or medications called the biologics drugs, and these are drugs that block a certain part of the pathway that is triggered in forming the psoriasis plaques. And this is a special category in which there are a number of medications available, and more recently there's been a drug brought to market which does not cross the placenta, so may be given to an individual throughout their pregnancy. The other biologics have also been used pre and during a part of pregnancy, with data suggesting that these have had a good safety, but because of the potential side effects associated with these drugs, the way in which they're manipulating the immune system, it would be very important that, again, there is a very detailed conversation about the pros and cons of using those types of drugs. And then finally, just to say, of course, the other option for patients is that they don't wish to have any therapy during the course of their pregnancy, in spite of the extent of the disease. And again, that would be their choice based on the information they've been presented to about the options they have. So we would be looking at the extent of the psoriasis and the impact the disease is having, and then weigh that up according to the risk benefit of having the particular treatment. What is interesting is that half of women may find that their psoriasis improves when they're pregnant, and around a quarter find that it might stay the same, and another quarter find that it may worsen. So when we're thinking of a specific treatment, for example, the UVB, we would look at what extent of disease the individual has, and then decide whether what we are offering is appropriate for the potential risks.